I welcome you to another video sequence in the context of leg lengthening, and today I would like to the duration. When the lengthening is finished and transitions into the so-called consolidation phase, that means when the lengthening process stops, you've basically reached your desired height, and then you transition into the ossification process. The important aspects that I would like to address here, one would be, how do I stop the clicking, or how does the transition look? Point two, also related to that, are the random clicks that can occur or have already occurred when you want to stop. Point two, also related to that, are the random clicks that can occur or have already occurred. Point three would be the final size, that is the correlation between what has been lengthened in the femur area, that is in the thigh area, respectively. That which you actually measure in terms of height gained. And point four is, of course, very important, the medications. How do you taper off the medications? Which ones do you use? Let's start with stopping the clicking. Look at themselves in the mirror or in front of friends or acquaintances, and then basically decide independently when you want to stop, when you have reached the desired size. And then you need to know that during the operation, we position the leg in a neutral position. And this neutral position is the outer click in the thigh area and the inner click in the lower leg area. That means when you finish a lengthening with the Betz bone, you need to make sure that the last click you make must always be the outer click. If the last click you make is the inner click, then you would have a wrong rotation. That means in the thigh area, the last click you make must always be the outer click. And you always have to confirm that in the lower leg area, which is desired for anatomical and technical reasons, the last click is always the inner click. That means it may happen that when the muscle tension decreases during lengthening, as soon as they enter the consolidation phase, this strong tension in the muscular area decreases piece by piece. And then the clicks will naturally become much easier to perform. It will be easier. If you happen to click inward, you need to confirm that you definitely made the outer click in the end. Before the bone ossifies, it takes days to weeks for ossification to occur. The complete consolidation of the bone is calculated with CA 40 days per centimeter in the thigh area and 80 days per centimeter in the lower leg area. That means until the entire gap is built up. Consolidated, remodeled with new bone. Takes about 10 centimeters. Surely a year will pass, but the movement is no longer possible long before that, because the bone has simply become solid. So that means we need to, going back to the click position, we have to ensure in the thigh area that we ossify with the outer click. And that means basically you have to, when you stop clicking, from the next day on, always take a position where you quickly check if you are also in the outer click area. And this position is the simplest in the world. That means you just need to sit cross-legged once. In the morning, after you have woken up, go into a cross-legged position for 1 minute, 2 minutes. Make sure that you have the outer click position, and then you can go about your normal daily routine. And you do that for the next 3 to 4 weeks. Then the bone is so solid in between that clicking is generally no longer possible. In rare cases, and it also depends on how quickly you have lengthened, or rather, how much distance you have lengthened. It can still happen that even after weeks, still have random clicks, especially when you turn on the leg under load or when you sleep and while sleeping. Yourself. Turn from right to left. The background is simply that you have no muscle tension at all while sleeping. And this muscle tension also stabilizes that area even more. That means when you sleep and constantly turn from right to left, it can definitely happen that you have a random inner click. When you wake up, just do the check. That means the cross-legged position, ensuring that you have an outer click, and doing that over the next days to weeks. Then you are definitely always safe. That the leg is in a neutral position, meaning it is rotated just like before, and you have no axis misalignment. The second aspect, that is the random clicks, are then relevant when it comes to the end of the lengthening. That means you can definitely have random clicks during the lengthening process. Random clicks are just clicks that happen in the normal course of the day without you consciously sitting down and actively going through the lengthening process. Random clicks aren't really a big deal. You just have to count them. When it comes to the end of the lengthening and you've had quite a few random clicks by then, whether it's 4 or 5 a day, then you need to stop. The active clicking a bit before. The end of the lengthening, because it's to be expected. That over the period of about 2 to 3 weeks until the bone in between. It's so stable that it basically completely fixes the rotational movement. Still triggers random clicks. It's not really a big deal. You can basically keep moving back into the neutral position. That means in the morning, do the cross-legged position to make sure that you are in the outer click area. The random clicks are highly individual. That means there are people who, due to the muscular fascia, that is, because of the tension and the pressure fitness. The nail in the bone tends to trigger random clicks. That means they have reduced tension, especially when you sleep. And if they keep moving in rotational movements, it can definitely happen that they trigger random clicks. But that's really not a big deal. As soon as the ossification of the distraction area has taken place, then these random clicks will stop right away. It can definitely be the case that if you've lengthened quickly, that it takes a little while until this ossification is fully completed. If you have lengthened slowly, then you are always relatively close to the ossified area. And afterwards, that is, as soon as you stop with the lengthening, it won't be long before a rotational movement is also not possible. The next aspect I would like to address would be the measurable size after a lengthening. In general, you come out of the lengthening with at least some minor functional deficits. That means most of the time the pelvis is at least slightly tilted forward. The knees slightly bent, and accordingly the spine in a bit of hyperlordosis, as we say. That means a bit more stretched out. This whole thing also affects the measurable size. That means if you have performed a lengthening distance of exactly 8 cm measured by the clicks, you won't be able to measure yourself with 8 cm more right after completing the lengthening, simply because you still have a smaller size there due to the functional limitations. As soon as you continue the stretching exercises, however, stop the clicking, the muscular tension decreases significantly, and you can continue to straighten up. In general, it takes 2 to 3 months until you are fully upright and the complete distraction distance is also measurable. That means right after the lengthening, you will still have a slight discrepancy between what you lengthened and what you can measure, but that balances out in the following weeks after the lengthening. That's point 1. Point 2 is, of course, that the thigh does not stand directly straight to the body axis. The thigh is slightly diagonal and has a forward bend. That means theoretically, or rather from a measurement perspective, you naturally lose length due to the diagonal. 1-2 millimeters in length, which then translates to a loss in height. You just have to know that is basically a theoretical size. But you have to know in terms of the extent of the lengthening, just know that it's 0.1. 0.2 is that the height also varies quite a bit between morning and evening. There are fluctuations of up to 5 millimeters. That's simply because the intervertebral discs lose fluid throughout the day. And you can notice a corresponding shrinkage of these intervertebral discs. For that reason, you're always a bit taller in the morning than in the evening. You just have to factor all of this into the measurements as well. Take that into account. When you do the measurement after the lengthening phase, and then wonder why you don't have the full, accurately measurable height, that would indicate the clicking. The next aspect that I would like to address in the context. During the lengthening phase, transitioning into the consolidation phase, the aspect of how to taper off the medications would be stops. We have anticoagulant medications, we have painkillers, and we have muscle relaxants. Let's start with the painkillers. The strong painkillers can be stopped by stopping the extension. To significantly reduce. We always recommend reducing the midday dose if you have doses in the morning, at noon, and in the evening. To reduce the midday dose on the first day, if that goes well, the next day you would reduce the morning dose and then the evening dose and continue like that until they basically don't need any painkillers at all. In general, you can reduce the painkillers relatively quickly because the tension significantly decreases. Within a few days, at the latest after a week, you'll notice a significant reduction of the feeling of tension and therefore don't need any painkillers anymore. I would reduce the muscle relaxants in the same way, only on a weekly basis. That means in the first week you skip the midday dose, in the second week you skip the morning dose, and in the third week you skip the evening dose. As soon as they have completely stopped the pain medication, they can also stop the stomach protection. It's important that you continue taking the blood thinning medications until they can walk somewhat normally again. That means until you can show a smooth walking pattern without forearm crutches. Until then, you should continue taking the blood thinning medications. Then you can also stop the blood thinning medications. The remaining medications, that is the supplements, calcium, magnesium, vitamin K, and vitamin D3, should be continued in a reduced form. Also during the consolidation phase, however, you can then double the intervals. As I said, the consolidation phase in the thigh area lasts about 40 days per centimeter. That means if you have extended by 80, or if you have extended by 100 millimeter, you will need 100 millimeter of extension. 400 days. It takes over a year until this area is completely bony, or rather is remodeled. In the lower leg area, it takes twice as long. The body needs per centimeter of structure. 80 days. That means for 10 centimeters, you will need 800 days. It takes over 2 years until everything is fully reconstructed. Those are the aspects that are important in this context. The end of the extension, that means pay attention to the click position after the extension is completed. That means always do the cross-legged position to ensure that they are in external rotation for about 2 to 3 weeks after stopping the extension. Gradually taper off the pain medication after the extension. Take the blood thinning medication until you have a fluid gait without using forearm supports. Pay attention. Please pay attention to the size, or don't expect to have the size right after stopping the extension. That you have specifically extended, that simply has to do with the functional limitations. And as the last point, random clicks are not a big deal. You should just include these in the final distraction segment. Please continue to do your stretching exercises after the extension phase is completed. This is important to ensure proper physical function. In general, They need another 4 weeks after stopping the extension to completely wean off the forearm walking aids, and another 4 weeks to achieve a normal gait. This should make the transition phase from the extension to the consolidation much easier for you. And then you have really accomplished something great. And I can only wish you good luck with the new size and have fun with it. All the best.